I'm Dr. Mary Larson. I'm an associate professor in the Department of Public Health on campus, and I'm so pleased to have you join us today. On behalf of the NDSU Department of Public Health, it is my pleasure to welcome you to this year's Mary J. Berg Lecture on Women's Health. This annual lecture is made possible through the Mary J. Berg Fund, which was established by Dr. Berg's father following her passing in 2004. The fund supports initiatives that advance women's health, including bringing distinguished speakers to NDSU to share their expertise and insights. Dr. Mary J. Berg was a graduate of NDSU, dedicated her career to understanding gender-related differences in medication response. She earned degrees from NDSU and the University of Kentucky before completing her fellowship in clinical pharmacokinetics at the University of Buffalo, State University of New York. In 1980, she joined the faculty at the University of Iowa College of Pharmacy, where she later became the first woman to hold the rank of professor in the college. Dr. Berg was a worldwide leader in pharmaceutical education and women's health research, serving on numerous boards, including the Office of Research on Women's Health at NIH. In recognition of her groundbreaking work, she was inducted into the Iowa Women's Hall of Fame in 1999. Her legacy continues through this lecture series, which provides an opportunity to explore critical issues in women's health and to honor her lifelong commitment to advancing knowledge in this field. With that, I would like to call Dr. Danielson up to the lectern to give a land acknowledgement.
Morning, everyone. I'm an assistant professor in the program, and I would like to read NDSU's land acknowledgement. We collectively acknowledge that we gather at NDSU, a land-grant institution, on the traditional lands of the Oceti-Sakowin, the Dakota, Lakota, Nakota peoples, and Anishinaabe peoples, in addition to many diverse Indigenous peoples still connected to these lands. We honor with gratitude Mother Earth, the Indigenous peoples who walked with her throughout generations. We will continue to learn how to live in unity with Mother Earth and build strong, mutually beneficial, trusting relationships with Indigenous peoples of our region. I have some additional comments. I invite you to visit the website of the Native Governance Center, which provides insight into the complex feelings that land acknowledgements can create, including that they're not helpful if they are purely performative. Their website includes action steps to go beyond land acknowledgement to meaningfully support Indigenous communities. Thank you.
Now it's my pleasure to introduce our guest speaker, our lecturer today. Women have played a crucial role in public health and medicine throughout history. Currently, women represent 70% of the global health workforce and 90% of frontline health workers. Women contribute significantly to improving the public's health through their roles as physicians, nurses, pharmacists, dietitians, community health advocates, scientists, academicians, and public health experts. They work to heal patients, study diseases, improve access to healthcare, create healthy environments, and address the root causes of public health issues. Throughout history, women have made remarkable strides in public health and continue to shape its future. Today, as we honor Mary J. Berg and Women's History Month, we are grateful to welcome Dr. Mariana Chilton as our 2025 Mary J. Berg's Women's Health Lecturer. Dr. Chilton's talk, entitled "When Women Take Control, the Whole Community Can Heal: Lessons from 25 Years of Action on Food Security," describes the creative ways in which women can take the lead in changing the dialogue on hunger and poverty in the United States. Dr. Chilton will describe her collaborative public health research, action, and programming that she writes about in her new book, The Painful Truth About Hunger in America. She invites us to transgress the usual boundaries of academia to engage in advocacy that seeks to transform our society through public policy, personal work, and spiritual courage. Dr. Chilton is a professor of health management policy at Dornsife School of Public Health at Drexel University. She founded the Center for Hunger-Free Communities in 2004 and served as the co-chair of the Bipartisan National Commission on Hunger. The commission was tasked with advising Congress and the United States Department of Agriculture about how to end hunger in America. She has testified before the U.S. Senate and the U.S. House of Representatives and has served as an advisor to Sesame Street and to the Institute of Medicine. Dr. Chilton has informed and appeared in documentaries such as The Feature Length, A Place at the Table About Hunger in the United States, and Crowd and the Cloud, Citizen Science with members of Witnesses to document water quality in Philadelphia. Her awards include the 40 Under 40 in Philadelphia, Mariana Unsung Hero Award from Women's Way, and the Had Ogden Award for Public Health Practice. Before we welcome Dr. Chilton to the stage, I'd like to just say we are using the microphones in the room, and so it's really important to kind of hold our enthusiasm and our chit chat because it will get picked up by the microphones while Dr. Chilton is talking. And I also just want to quickly recognize a support team that was critical for this event, including Maeve right here, Lauren, who is on the call on Zoom. And I want to welcome everybody who's on Zoom. And I just couldn't have done this without them. Please join me in welcoming Dr. Mariana Chilton.
Good morning, everyone. Hello, everybody here in the room. Hello to folks on the Zoom. Can you point out where the camera is so I know what's cooking? Ah, way back there. So do I need to stand behind the lectern or am I good to wander?
You're good to wander. Yep, it's all set.
Hey. Thank you. I'm so delighted to be here. And it's a total honor. And I feel very honored also to be giving the Mary J. Berg Memorial Lecture. I think this is a beautiful honor and a gift. And I'm really grateful for Mary J. Berg for setting. I know that she is standing on the shoulders of giants, of other women that have come before her, and women before them, and women that go all the way back into time. And we have to really lift up our women colleagues, our women identifying colleagues, because it is still tough. It's still tough out here, as those of you who are women know, and those of you who are men who are probably also recognizing. So I'm honored to be here, and I'm honored to, and I feel so grateful that I can swing open the doors and just unapologetically talk about women and women's power, because that's a beautiful thing. We should be doing it a lot more often. So really, I'm standing here hoping to bring back the matriarchy. Yeah. Okay. Before we get started, I just have to do this thing where let's see, gentle touching of the thing that will make the thing move. Maybe I press up. Oh, you say press down. It's recognized. I don't know why.
There you go.
If you great, I clicked it. Yeah. Dr. Pamela Joe. What is Dr. Pamela Joe's last name? Johnson. Dr. Pamela Joe Johnson explained to me about this wonderful stone that she and her family like to collect in Montana, in the Yellowstone River, and these are Montana moss agate. Do I have that right? I had never heard of that, and so I had to look it up, and then of course I wanted to look up the properties, and apparently Montana moss agate helps us to stay grounded and helps us speak the truth. And I thought, well, that's wonderful. So before I get started, what I'd like us to do, because I know that the world out there and also the world between our ears is pretty raucous right now. So that they don't hijack our beautiful spirits and our original beauty, I just like us to close our eyes. If you're willing, you can keep your eyes open and look at this Montana moss agate. And let's just take a few breaths together to just stay grounded and get into present moment. And I'm going to do the same. Good thing to do is just feel yourself in your seat, feel your feet on the ground, feel gravity. All right, thank you. I think it's so important to stay calm. Number one, stay calm. It's so easy to get activated by what's going on. And what I'm going to talk about in my presentation to you is the experience of trauma and intergenerational trauma. So that's one of the many things I do in my classes or before I give a talk is just to stay grounded, get everybody who I'm in community with to be in the present moment and to be in a place of beginner's mind. You have no clue really about me. I mean, you did hear a bio, but that doesn't tell you much, and I don't really have much of a clue about you. So we're in a place of not knowing, and how beautiful is that? So beautiful. Nice to see you all in this place of unknowing. Now, is this gonna work for me? Maybe. Yes. Thank you. Thanks. So before I get going, also I want to honor my personal relationships with so many people who helped me along my way. People often refer to their people that they do research with or on as research subjects. And I've always considered people that I work with to be partners and my professors. They're my teachers. So I come to them as a beginner. I come to them as someone who knows nothing so that they can train me up and teach me and help my heart to expand and to grow and to mature. So I just want to honor the so many, like thousands of people who've helped me along the way. Starting out with the Cheyenne and Arapaho tribes in Western Oklahoma. So I'm going to talk to you about my trajectory over the last 25 years. I'll explain to you why women, although that really should be obvious. I'll talk about what's happening in my book, The Painful Truth. And I just want to say thank you so much to the department for purchasing the books and making them available to all of you for free. Wonderful, and I'm happy to sign them if you so choose. And if you don't want me to sign, that's cool too. Just put a little heart on the inside that has your signature. In my signature, that's what I include too, and you'll understand why. And then I'll talk about different ways of taking action. And I'm going to talk for about 40 minutes, and I hope that we can have a dialogue, and I look forward to the folks on Zoom also participating through the chat. You'll give instructions maybe about how that goes. All right, so yes, I did author that book, and it is actually real. It's amazing that was here and here and here. And now it's on paper and in a book that you can hold. That's amazing, isn't it? I'm advised on the movie A Place at the Table. I'm not sure if you've seen it, but if you haven't, it's still actually relevant, sadly. I have been an advisor to the Institute of Medicine, and of course, my favorite, been an advisor to Sesame Street. There was one time I was in my office and I was listening to some videos that Sesame Street had sent me, and Elmo was singing with some broccoli. And it was so fabulous. And my colleagues kind of peeked around the corner and said, "What are you doing?" And I'm like, "Shh, I'm working." It's amazing that even Elmo and PBS, public television and public radio, are under threat right now. Distressing. So let me tell you about the Center for Hunger-Free Communities. We founded it in 2004. But again, really working with the Southern Cheyenne and Arapaho people has been really instrumental for me. So I want to talk about that. It's very important for sort of my own professional origin story. I also started doing research in the food pantries in the city of Philadelphia, where Drexel University is, and I learned a lot from the women that I interviewed there. And they're the ones who explained to me that violence is underneath the experience of food insecurity, and they forced me to reckon with it. So I started the center in 2004 with bringing the city of Philadelphia into a multi-site study called Children's Health Watch, which looks at the impact of public policy on the health and well-being of young kids and their caregivers. I won't talk too much about that. That's an ongoing study that's over 25 years old, and I encourage you to just Google it and find out their work. I was the PI of that for 15 years. I also started the GROW Clinic, which is a clinic for children with failure to thrive. It was a multidisciplinary clinic for children who are falling off the growth chart. That's still going well. I started Witnesses to Hunger. I'm going to talk mostly about that today. And that's a participatory action program where I worked alongside of women who know the experience of hunger and poverty firsthand. I gave them digital cameras. This is before the iPhone. So digital photography was a thing, but you really needed a separate instrument, a camera, Canon PowerShot. I gave them Canon PowerShots, and they took photographs of their own lives, and they were the ones who were framing the conversation, literally framing it through their own camera view to teach the world, teach the public, policymakers, and the press about their experiences and what they wanted people to do. I also did some understanding that violence is really like a vector that carries hunger across the generations, or thinking that it might be. I did some studies on child hunger, the most severe forms of food insecurity and hunger in the United States. And from there, I built a program called the Building Wealth and Health Network. And that started out as a randomized controlled trial. And this was a trauma, or it's still ongoing. It's in its 10-year anniversary. It's a trauma-informed peer support program that helps women build up their wealth we help them open bank accounts, put money into their accounts, and also work through their experiences with trauma to help them heal and they help each other to heal. I'll talk a little bit about that. And then lastly, we opened up a cafe. It was a community cafe where people could come and eat a 3-course meal, no questions asked. And we would tell them what the worth of the meal was, and then they would leave as much money as they wanted or could. Again, no eligibility criteria, no questions asked. And that lasted for about 2.5 years, but we had to close it down because it was not financially sustainable in this ultra-capitalist environment, but we did our best. Anyway, I start the book talking about the grand opening of the Eat Cafe, and I will not ruin it for you because it's complicated. Can't do this great work without just tremendous staff. So many people have helped to make these programs work. This is some of my staff over the years, and they're still at it. Most of them are still doing public health practice at Drexel. And really, all of this work is in service of making sure that women are taking the lead. Women are speaking directly to the most powerful people in this country, and also changing the dialogue about hunger and poverty. I'll tell you how we got there. I also, sometimes the women would come, they would just leave me their children and say, I have to take care of my baby at home, but here's my son. This is Jazir Sutton, who decided to come with me to the Capitol, and he's getting a school excuse note from then Vice President Biden. So now he's a dancer and dances with, what's her name? True Jackson. Oh, what is her real name? Anybody? Come on now. You're all too old to know. You're too old. That's right, he's looking at me. Forget it. Let's see. All right, so my training is in folklore and folk life. That's actually how I started to work with the Cheyenne and Arapaho nations. I was really interested in ceremonial tradition and practices, music and drumming and prayer, and how that had an impact on people's health and well-being. I'm also an epidemiologist, so I do a lot of mixed method stuff, but I'm an unusual character, a little bit like Snoopy is an unusual character in Peanuts, and yet essential to the conversation. But there's just something about bringing in a lot of diversity, people with different kinds of training, and something about a folklorist just wants you to go out on the edge and maybe fall through the ice. So join me in doing that. I want to bring you back to my original experiences with the Southern Cheyenne and Arapaho tribes. This is the entrance to Concho, Oklahoma, where their tribal headquarters are. And these are some of the people that I worked with, and this is just some images to kind of hold your space for a second. Well, I'll tell you two stories, or one story that has two lessons. I was friends with Gideon Bison, who knew the ceremonialists among the Southern Cheyennes. And he knew the head of the Tribal Health Board. His name was Willie Fletcher, who was a very dear person to me and a mentor to me, who never finished 8th grade. I think he stopped going to school in 3rd grade. Anyway, he was the chair of the Tribal Health Board. And I was presenting like this in front of the Tribal Health Board at age, I don't know, 26, 27. I said, oh, cross-cultural issues and care are so important. It's a matter of social justice. And what's happening to the Cheyennes and Arapahoes is terrible, and doctors need to know better, and we can help. You can help me to help them and get some training on cross-cultural issues. And they burst out laughing. And Willie Fletcher said, that's great, Mariana, but what we really need is a dialysis unit and some crutches. Can you help us with that? And as a white lady from the Northeast, you can imagine how red my face got. No, I had no power, I had no idea how to do that. So that was an important lesson. First one, that was in the meeting. Coming out of the meeting, my friend Gideon said, Mariana, you embarrassed me so much. That was terrible. And I said, oh, I'm so sorry. I really thought I did a good job presenting and talking about justice. And he said, Mariana, we don't want to hear about justice. We want to know that you're here because you love us. You care about our people. So 2 really important lessons as a young doctoral student. Those lessons stick with me throughout my life and throughout my professional career. Is that always do your work with love for the world, love for the people you're talking about, love for the people you're hoping to help and to serve. And also loving yourself and loving the earth. It's like, it's a very expansive experience of love. All right. What else is this person? Other foundational experiences, when I went from Oklahoma to Philadelphia and started working with women who use the food pantries, I didn't know enough about food insecurity and hunger at all. I still don't, I'm still learning. But what I learned from the people who were in this original study is that the experiences of violence were far more important than experiences of not having enough money for food. And as a matter of fact, it was almost a one-to-one connection. You can read more about that in the book. Anyway, you can find that original. It took me several years to figure out how to analyze it and talk about it, to find the words that the women taught me, but that was really important. So what is food insecurity? I'm assuming that all of you must know, but just in case, here's a little primer. Food insecurity is a lack of access to enough food for an active and healthy life. So it means having enough. That's what people think about as hunger, is like there's not enough food to eat, right? So you're emaciated, etc. But there's another component, and that is the component of health. So you can have plenty of food, but that might be oodles of noodles for weeks on end. And that's not good for an active and healthy life. So it has 2 components, the enough factor and the health factor. I think I have only one graph. I managed to pull out most of the graphs to keep this sort of more general, but within the concept of food insecurity, which is the lack of access to food, are 2 supposed categories. One is low food secure. You can learn about it more in the book about why something that would be secure in a category called insecure, but it's just too complicated for me to get into the details. And then very low food secure. And this is really when people are experiencing what some people would call hunger. It used to be called food insecurity with hunger. And that means that there's lots of disrupted eating patterns because there's not enough money for food and food intake. And also losing weight because you don't have enough money for food. So that's the most severe form of food insecurity. And it's even more severe when parents admit that their kids are hungry. It's very rare for parents to admit that, because they're afraid that the doctor will report them to the Department of Human Services, or I don't know what you call it in North Dakota, but they'll get reported and their kids might be at risk for being taken away because people don't have enough money for food. So it's getting deep already. You can sense it. All right. One other thing that we need to think about in terms of the rates of food insecurity. Currently, food insecurity is about 10.5% or 11% of the national population. That's the national rate. All right, but if you think about the inequities in food insecurity. Who have the highest rates? Indigenous communities, Native communities. They have rates of between 25% to 80%, and in the Klamath River Basin in Oregon, 90%. So it depends a little bit on where you're measuring it, how you're measuring it, who you're measuring it among, but extremely high rates. Also very high rates among people with disabilities. People with disabilities report food insecurity rate 40%. That's 4 times the national rate. And it goes on from there. Women-headed households have 3 times the rate. Black and Native American households have 3 times the rate. Hispanic, Latinx households that were born in the United States have very high rates of food insecurity and hunger. Immigrants have 5 times the rates, 5 times the national rate. People who identify as LGBTQIA+ have much higher rates, and people returning from prison, 80%. All of these groups have in common, they're all discriminated against. Knowing that, and you all know this in public health, or if you're working in nutrition, you know that you have to pay attention to who is most vulnerable, what populations are most vulnerable. Of course, there are far more white people in the United States that are food insecure than there are Black people who are food insecure. So in terms of numerics, yes, it is a major white problem, a white person problem. But in terms of the depth of suffering among certain populations, depending on how you draw the boundaries, of course, those who are most discriminated against are the ones who most experience food insecurity. Knowing that, it forces us to look way beyond food. And I argue that on page 1 in the book, to address food insecurity and hunger, we have to go beyond food. Learn about what's going on. Remember Snoopy skating on the ice, and here we are about to fall through, which is what I'd love all of you to do with me, is to coming through on some thin ice. So we know that food insecurity is associated with behavioral challenges, physical illness. Children's Health Watch, the study that I did for many years, we were proving this over and over and over again. Food insecurity, housing insecurity, all of these things are really tough on physical, mental, and emotional health, and they affect school performance among kids and adults and work performance. So I'm insisting that we've got to get underneath all of the women that have taught me over the years. We have to think about trauma and loss, about adverse childhood experiences. I'll explain what those are. Can I have a show of hand of anyone, people in the room who are familiar with ACEs, adverse childhood experiences? Okay, I don't have to get too much into the deets. I can go quickly. But adverse childhood experiences are really nested in larger social contexts. So we have to think about our history, think about trauma over time, and get all the way back to colonization, genocide, and enslavement in this country, on these lands, among our people, in our bodies, in our DNA, all of us. So that's what the book is about. And knowing that, it's starting to get a little complicated. I think I've gotten you to page 3 by now. It's hard to say. So looking at it another way, thinking about colonization and enslavement, violence, and injustice, we know that there's plenty of research that shows that this disrupts our relationships, causes poor school and job performance, poor physical, mental health, etc. Precarious living conditions. In other words, economic insecurity could be the way we talk about it, right? And that's often how we do it. And then us fancy researchers, myself included, I'm complicit in this. I know how to measure food insecurity. I can measure housing insecurity, energy insecurity. And then because I'm in public health, I say, yes, this food insecurity as a social determinant of health is really bad for your health. And I can actually build up a whole career just saying that. And I'm rewarded for it, but I'm insisting that we're just skating on the surface. And the more that we use biomedical approaches and focus on food, the more that we have diminishing returns. We're not doing enough. We're not getting at the causes, the root causes. So I'm insisting that we need more research and policy interventions underneath that address issues of racism and sexism in our history, of course. Oh, and love is what's going to help melt that ice. I forgot about that little animation. On the front cover, you'll see on the book is that leaf. That's a Bodhi leaf. So it's sort of, it has at least 2 meanings. The Bodhi leaf is a symbol of the tree where the Buddha became enlightened. So the first message in the cover of the book is, wake up, awaken, let's awaken. But notice that it's in a heart shape. So that for me is also, we need to bring in more love into the world. So let's awaken and bring more love into the world. Understand why. So there are two superheroes of the book. One of them is Julie, whom I met in that first study. She needed some money. I didn't have any money when the second time I met her, had a really long interview the first time I met her, but she met me a second time and asked me for money. I said, I don't have any on me, but if you come back to my office, I can give you the leftover cash. Any researchers in here that on occasion have a leftover cash, a little gift card somewhere? Don't admit it, it's okay. Save it for that research participant that needs some cash outside of the bounds of research. Anyway, she said, Mariana, when you asked me about my experiences with hunger, I didn't realize how bad it was, and I realized also that I hadn't told anybody how bad it was. And what I think you're doing is really important, so I'm giving this to you, bless you. I'm giving this to you so that you can teach the world about what it's like. So that put me on the hook for showing you this image. This is Julene speaking directly to you, wanting you to see, and this is how she explained it to me. There are about 5 lessons, 5 surfacey lessons. The first one is to share food makes you human. In the middle of the barrel is a cutout from her Bible or Bible studies. And she loves Matthew 7:9 that goes, what man is there among you who, if his son asks for bread, would give him a stone? Essential here is what man. In other words, if someone comes to you and says, do you have any food? And you don't give them food, and in fact, you give them a stone, you are not a human being. You're not a quote man. In the same way, you are disrespecting the humanity in the person who's hungry. So I think all of us have a natural tendency, if someone around you needs something that you have, and they're somehow in your proximity. In other words, if you have food and you share your food, you are sharing your sense of humanity, your kinship with the human family. So that was lesson number 1. Lesson number 2 is that hunger doesn't happen by itself. She said, I had nothing. I didn't have a house. I didn't have money for clothes. I didn't have anything. So hunger never happens in a vacuum. It's not like everything is fine in your house. You're paying your rent. You can pay your car payments. You can get gas. You can keep your car registered. So many things we need to have in order, right? It's not like everything is fine and you're hungry because you don't have enough money for food. You're constantly trading off, paying different bills in order to, and sometimes not eating so you can pay the light bill, those kinds of things. So it doesn't happen by itself. She said, even the nothing I have is falling apart. This is a nail that's coming out of the barrel. Hunger is a manifestation of severe stress. I asked her, why did you use orange and green? She said, oh, that's just stress. It was stressful. It's like an electric shock, ongoing all the time. That's trauma. Enters the body, the bloodstream, it inflames you. Thirdly, hunger means you're isolated. She had no one she could count on, no one to help her. A lot of times people can prevent experiencing severe food insecurity because they have friends and family that they can count on, or even neighbors, or sometimes people will send their kids over to the neighbor's house because they know that they maybe have got their food stamps, or that they just, came into some money, or that there's some hot dogs over there. And there might be extra for the kids, right? The other thing is obvious. She's putting it into Sharpie. She says, involve me. I remember. I understand. In other words, don't tell me what to do. Involve me. In other words, join in solidarity is the same lesson that the Cheyenne and Arapaho tribes would teach you. Involve us, right? Join in solidarity. Join because you love us. From there, I realized I needed to figure out how to do that on a grander scale. So the next real qualitative and quantitative study I was doing is Witnesses to Hunger. It's a participatory action program. Keep your eye on this person. That's Joanna Simmons. That's Tiana Gates Turner. There's so many others. These are my professors that have taught me so much. So what is Witnesses? Participatory action research. In the research, we were trying to understand the relationship between food insecurity and mental health challenges. Participating in public assistance programs. And it's ethnographic, and we were using something called photo voice. And in photo voice, it's like, I'm the researcher here, right? I'm the PI, the fancy professor, right? And usually it's the researcher that defines all the questions And are you looking for a cup?
Just with
Yeah,
water.
Okay, so nice. I can feel it happening, sorry. The photo voices that you're giving all of the research to the people who know, who are closest to the issue at hand. So I said, I don't know anything about hunger or food insecurity, but I'm interested in your experience with participating in food stamps or WIC. I don't know, you teach us, use the camera as your friend, take photos of what you're experiencing and tell us why you took the photograph and what you want people to do. So it's social action, right? That's photo voice. How did we take action? We created exhibits out of the photographs. We always made sure that legislators were there, key community leaders were there, that the press was there, and people of the general public. As an example, here's Imani Sullivan. She's a member of Witnesses to Hunger. This is the photograph she took. So people might think of this as like, ooh, the data, right? But this is her child. And she took a photograph of her child when they were applying for emergency food stamps. And they hadn't eaten in 3 days. And she's explaining how painful and troublesome and stressful it was directly to a United States Senator. This is Senator Bob Casey Jr., Pennsylvania Senator. And we're at the United States Senate, Russell Rotunda. So you see how that works? You can be very creative. It doesn't have to be in a policy brief. The best thing you can do is to get Imani Sullivan speaking directly as a human being in the same room, in the same moment, in the halls of power, literally. That's how it works. Thank you so much. The idea is to get me out of the way, or the researchers out of the way, and the women up front with the microphones, right? Because they know that experience they know what's happening for them, and they're the ones who should be speaking. Beyond that, that sounds all very sophisticated, and it is, but the most important thing is a social bond. I was reading Urban Staub, and we'll learn about that in the book, about how it is that the Holocaust could happen. How is it that the Nazis could dehumanize people and murder 6 million Jews, people who are gay, and people who are Roma, and all the people who wanted to help. And he explains that once a person can dehumanize you, they can squash you, oppress you, murder your family, etc. So I was trying to think, how can I build social bonds, a sense of kinship, right? This is a deep lesson from Julian in that original painting. So that's Tiana Gaines talking to Senator Harry Reid, who was the majority leader in the Senate in 2009. Here's a photograph in the back. It's an exhibit. I'll show you that photograph in a minute. And the idea is that we'd like to see women in power, and because they weren't in power, we like to pretend that we were here at the Boston State House. This is Tiana Gaines Turner. She was invited to give formal testimony to the Budget Committee, the House of Representatives. That's Paul Ryan, and this was a war on poverty hearing. And here's what she wanted people to know. She said, I want you to know that when one child is sick and had to be hospitalized, all 3 of my kids, she said at the time, have major health problems. So when one kid gets sick, I have to go to the hospital and be with my kid. That means my husband has to stay home and take care of the other kids. That means both of us can't go to work. That means we don't have enough money. That means we have to decide in that moment, are we going to pay the rent or the light bill? So you can see how a child's health is deeply connected to all of the financial challenges and troubles of just trying to live, trying to survive. She also said, I'm showing you this picture. We just moved out of the hotel for the night. We were homeless at the time. I want you to see the stress in my children's faces. Again, go back to Julian's painting. Remember the stress, the orange and green, the body. Tiana is expressing the same thing. It is stressful and harmful. And then she also wanted people to know that she has a loving family. There's a dad, there's a mom, there's the kids. This is, simple family unit. She has to break the stereotypes that she is a single Black mom, right? It's just atrocious that people have to just claim that they're human, claim that they matter. We can do so much better. Anyway, that's what Tiana was wanting to get across. And there we are. We were getting ready to do another exhibit in New Haven. We have multiple sites in Witnesses to Hunger: Philadelphia, Boston, Washington, D.C., New Haven, Connecticut, Providence, Rhode Island, and Martha's Vineyard Island. Anyway, that's Tiana in the middle. And it just gives a good feeling of sense of power to be able to speak the truth, especially if the truth has been very hidden by our society, but also we often hide whether we're struggling or not. It's an important lesson. We use a number of different strategies, and I'm happy to share these slides and show you how we do it if you get more about it. Skip that. This was one of our last moments of triumph when we were at the White House Summit on Women and Girls back in 2016 before the election. Oh, all right. I could stop there and we could say, yay, rah, rah, shishkumba, this is how you inform policy and how you change and everything's fine. But it's actually goes so much deeper than that. So now that we're plunging under the ice, gentle advisement, take good care of yourself, remember breathing. Remember that you're a breathing, living, beautiful human being, your original beauty. All right, second superhero of this book is Joanna Simmons. You've seen her a couple of times in these photographs. I'm not a big fan of like superhero and heroism in hunger work, but just because Joanna dressed like this before a radio interview, I just figured, hey, Joanna is a total superhero. And that's us at the White House Summit. This is her photograph. This is her kitchen. This is a doll, not a human. And she wanted people to see this because she said things are so bad that you're afraid to ask for help. She's living without running water. You can see that her kitchen doesn't work. She doesn't have electricity. She cannot cook. On the outside, however, the facade of the home is very lovely. We never know what's going on the inside. So she talked a lot about hiding it very well. And she told her she was living there with her, the father of her kids, and her two kids were age 6 and 2. She would tell her 6-year-old, don't tell anybody what's going on at home. Don't tell them that we don't have water. And you can see how the secrets pass on from parent to child. Of course, she's doing that to protect the child, to protect herself, because she doesn't want to get separated, because she's a fantastic and brilliant mom, but she's afraid that her child will get taken away. This is another photograph. You can't really see because of the lighting in here. But this is a photograph by Crystal Sears. She said, thanks to food stamps, my daughter was able to eat breakfast this morning. But in a similar fashion to Julene's painting, where Julene is like looking right at you, this kid is looking right at you. No matter where you are in this room, she sees you, which forces us to think, okay, what is she asking of us? Feels to me like she's at the edge of the cliff in this. The only thing that's keeping her from falling off that cliff is a bowl of cereal. Beautiful image. This was the image that you could see in the background when Tiana Gaines was shaking Harry Reid's hand. This is a photograph by Whitney Henry. She said, I was walking to the bus this morning and clearly someone got hurt and that blood was still wet and I'm walking with my 2-year-old who's wearing sandals. So sick of this. I'm sick of this, she said. So tired of this violence. And then the women would turn the cameras on themselves. This is one of the earliest photographs by Erica Smalley, and she just wanted people to know how painful it was. Again, this is her choice, what she chooses to show. All right, then that's another self-portrait of Imani. Remember, she was at the United States Senate. All the different kinds of stories that were coming up were about rape, about being abused or neglected as a child, about witnessing the murder of family and friends, or having one of their parents in prison, community violence, and then I add here mistreatment by caseworkers, because it was often mixed in when they would go to the county assistance offices, treated as if they were not human beings, as if they were an animal or a criminal or both, just trying to get some help, made them feel humiliated and dehumanized. So I consider that another type of violence. There's so many different kinds of violence. You can find my publications online. So I had to start learning about trauma. And a lot of us think about like individual trauma across the lifespan. We can understand that rape is a form of trauma, it's individual, and it actually affects a person across their lifespan. And we can understand sexual abuse, disasters, those kinds of things. Those are sort of standard what we know, and we think it sort of affects an individual or a veteran, and maybe their family a little bit. But we just tend to focus there. But I want to introduce you to other kinds of trauma, historical and intergenerational trauma. Dr. Maria Yellowhorse Braveheart, actually a brilliant researcher and author, talks about historical trauma as a form of unresolved grief over the generations. Sometimes that's referred to as a soul wound that gets passed on throughout history. Then there's intergenerational trauma. You can have someone like the people who've studied survivors of the Holocaust. They have grandchildren who experience some of the same sort of physical sensations when they hear things or see things. It turns out that trauma actually can transfer through our DNA, not just our behavior. And then there's also racial trauma. So it's the mental and emotional injury caused by racial bias. But what does trauma do? It affects our brains. It affects our endocrine system. It creates triggers and flashbacks, hyperarousal. And it also affects our ability to make money, to do well in the job. Can't tell you how many times members of witnesses would say, oh, I just got fired because I just started yelling at the boss and he deserved it. And sure, the boss probably did deserve it. But it's so hard to have to go then back to the caseworker to apply for public assistance, and then you get your job, then you can't keep your job because you're pissed off and everybody's pissing you off and you go around. All right, so I wanted to talk about average childhood experiences. Most of you know about it. 3 domains: abuse, neglect, and household instability. And there are different subcategories, and there's a 10-point measure. And we understand that ACEs is actually related to all of the major chronic health conditions in the United States, associated with cancer, diabetes, obesity, not to mention depression, having more fractures, risky sexual behaviors, those kinds of things. So it's really important in public health. I want to pull you right into emotional neglect. Ooh, there's a pointer. Isn't that red thing? Anyway, emotional neglect. The question goes, did you often or very often feel that when before the age of 18, no one in your family loved you or thought you were important or special? And that the family didn't look out for each other and were close to each other. Because I was picking up so much violence in my qualitative work, I decided to put it in my Children's Health Watch work and start to just do it in numbers, because I'm thinking, well, maybe I can't do a triangulation and maybe this is not really real. Maybe people are like performing something for me. I didn't think that, but a lot of people who were looking at my work were projecting that onto me. When I was presenting. So I thought, I gotta get a bigger sample size. So, So back to Children's Health Watch, I'm not gonna get into the details, but we had over 1,200 people that we interviewed over the course of 2 years about food insecurity, housing insecurity, and ACEs, which is a numeric measure. It's a 10-point scale. Watch what happens. Here are some of the ACEs: emotional abuse, physical abuse. Here's emotional neglect. Having a family member who has major mental illness is a form of ACEs, or having a mom or dad who is in prison, form of ACEs. Yellow line, food security. People who are food secure are reporting average health experiences for sure. Watch low food security. Remember that sort of that's food insecurity that's apparently not as severe as the more severe form. So that's the middle one. So look at the middle. Look at emotional neglect. Look at very low food security, the most severe form of food insecurity. 56% of the people who reported emotional neglect reported the most severe forms of food insecurity. You think it's heartbreaking enough to like hear people's stories and to know them and sitting there, but then actually you start talking the numbers. And control for all else, and this is what sticks out. That was a real gut punch, and I've started to call this lovelessness. Lovelessness at the center of food insecurity and hunger. We know that ACEs don't just happen in a vacuum and the way the hunger is happening in the vacuum. ACEs are actually, you think about, so these are the different ACEs, right, in top of the tree, but what are the roots? Underneath here, discrimination, lack of opportunity for housing quality, redlining, those kinds of things. And this is the kind of environment that creates conditions for parents to hurt their kids, for kids to be exposed to major adversities. So it's like a fractal. Just like then it, I'm thinking, oh no, justice. And now my data and the people are telling me, no, love, 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 love. It's a tough one as a researcher, right? I need to get training on how to do this kind of stuff. But because of what I learned, I wanted to create healing supportive programs. So in knowing that public assistance itself, and I have a whole segment of this in the book about how our systems are built on racism and discrimination and actually are built to traumatize people. That's this middle segment of the book. Anyway, knowing that, I wanted to figure out, oh, I want to change the cash welfare system. Well, that's me. I have lots of ideas about how to do that. Anyway, I also wanted to help people along. There are lots of different violence prevention programs. Remember that if you're working on violence prevention, you're also working on hunger prevention. Okay. So, and if you're working on violence prevention, maybe you can find ways to bring in food or money for food to help people. So we built this program called the Building Wealth and Health Network. It's a trauma-informed peer support program, and we help people open savings accounts. And we help people get an economic insecurity by infusing lots of love and opportunities for love to build economic security and more peace and justice in the world. We do trauma-informed healing centered peer support, financial empowerment work. I'm not going to get into the details, but I can tell you more. Question and answer. We have an advisory board of women who've been through the program who then teach us about how to improve the program. One of the many improvements they made was that some of the incentives, they didn't really like them, and what they really wanted was a massage and a facial. So we were pretty popular / unpopular at Drexel University because we would be reimbursing people for their facials, or we would put it on the purchasing card. Imagine what my dean thought of that. In the meantime, it is a hunger intervention. It started out as a randomized controlled trial. I'm skipping so many details. I'm skipping so many details of our methods. But what we found is that those who participated in the Building Wealth and Health Network program, overall, they became food secure after participating in our program. And we wanted to see, how does it work if they have high ACEs? And it was especially good for people who had 1 to 3 ACEs or 4+ ACEs. Those who had no ACEs, still kind of worked, but it's not statistically significant. So that was the idea. We were hoping to somehow help people heal from the violence. And doing that, we had hoped that it would reduce food insecurity, and there it is. Oh, that's the second time I've shown that. And guess I'm going backwards. Now I'm going to go forward. Here's an example. We also asked the members of the Building Wealth and Health Network, like, how did it go for you? So how was it you when you started? Oh, this person said it was cloudy, rainy, and cold, and here's the river of life, and I was not getting enough help. And now it's sunny, and in the middle it says, love myself. And it has, going to therapy, praying, love, self-respect, a good listener. So they were learning some good emotional management techniques. Oh, I have so much more to say. I'm keep going backwards, but that too is not enough. And that's part of the painful truth, which is why I say we need to reconsider everything. And then I'll get to the point where I'm going to stop. The third part of the book talks about 3 different domains of action. First one is political action, and number 1 and number 2 are to focus in on the people who have the highest rates of food insecurity and hunger in this country. That would be Native people and Black folks and immigrants. So that means, number 1, land back. Giving land back to Indigenous people. That's what they want. They want they want their own sovereignty. Number 1, what they need and want. So we have to think about how to decolonize. Secondly, reparations for people who are descendants of people who were enslaved. If you think about trauma, and you think about you want to address food insecurity. Well, food insecurity is related to so many other things. Gotta go deeper, deeper, deeper. You have to deal with the wounds of trauma. The original wounds in the United States are genocide and enslavement. And if we aren't facing that and reckoning with it, we are going to create more and more problems. Trauma begets more trauma, begets more trauma. It's a fractal, right? And we're experiencing that in this country right now. It's phenomenal to watch it as a researcher, like, oh, I see this pattern, I see that pattern. So many patterns repeating themselves. I also talk about universal programs, the need for universal basic income. We have these questions we ask everybody, like, are you eligible enough? Are you poor enough to get help? Are you poor enough to get this home? What that does is it separates people. It puts people in the worthy category or the unworthy category. We need to get rid of that. So universal basic income, number 1. Universal health care, universal preschool. Universal childcare, that would do so much for women. You can read more about it in the book about what kind of financial impact it would have on. I just saw something this morning that said 80% of women who are elderly over like age 65, 80% are living in poverty. And yet we're out here working. We're doing like, we're frontline healthcare workers. We're like the front line. We're taking care of kids, we're taking care of elders, and we're poor when we're old. We should be far wealthier. And then there's, I talk about the right to food as well. That's not enough, because knowing that our systems have imbued in them violence and can be traumatogenic, they're reflecting our society. And I just skipped over that whole segment. I don't have slides on that today. We have to undo, we have to work on ourselves. We have to undo some things in how we think. I'm a white woman, upper middle class white woman from the Northeast. Oof, boy, do I come with a lot of baggage. One of them is I am superior to everyone else, because I was taught that. You're smarter than everyone else, you're gonna go to the best schools, you're gonna have more money. That was pushed on me. Gotta produce, and you gotta do it now. It's a white supremacy culture. I think I have a slide on that, but I wanna stop so we can talk. We also have internalized racism in ourselves and how we operate in our workplaces and in our own family lives, colorism as well. And also sexism. I can't tell you how many families I know that somehow tolerated abusive women in their own families. And in my own family, when I spoke up about someone in my family getting abused, I was considered the bad person. Even the person who was getting abused was trying to hide it and was, making me feel bad and look bad for what I was doing. We have so much work to do, people. I'm still working on myself, as you can imagine. Still can't find the forward button. Lastly, thinking about the lovelessness that is just too much for me to bear as one soul. And I'm so grateful I have so many people that I work alongside, beautiful staff, beautiful people that have taught me so much in my studies. They teach me how to love and expand my ability to love. We have to bring more love into the world, especially now where we have people in charge who have very little empathy, if any empathy at all. So just being a loving person is a beautiful form of resistance, and it can be a beacon for the people around you. Just smiling and expressing your care for others is number one. Number one. We have a culture of domination. That's how we Mariana, you're good. I got second in a race, and I was really proud. I said, Mom, I got second. She goes, that's okay, but that wasn't first. Imagine what that does to a 9-year-old, running their own little track, love team. We have to get rid of this culture of domination, of always being first, being the top, America first. All of that is just so damaging. Can we change? We have to revolutionize our culture. Clearly, we have allowed hunger to exist all this time. We tolerate it. These numbers come out every year. We tolerate food insecurity and hunger. That says something about us as a society, doesn't it? And we're the supposed richest nation in the world. Tough. I will stop there because we need to discuss, but I explained that reparations is not just about money, it includes policies and making sure that people have access to medical and mental health care, universal basic income, right to food. These are the poisons of white supremacy culture. Let me see, paternalism. That's a good theme. This very paternalistic idea that, men are at the top, at the head of the family. We're seeing more about that now, I think, in the public discourse. Back in the 80s and 90s, and 70s, caseworkers would knock on the door and try to catch the man in the house, because there was a man that meant the woman didn't deserve to get public assistance. Oh my Lord, some of you may have lived through that. Actually, I think many of you have, because you don't know who Drew Jackson is. The progress is bigger, the sense of urgency. I'm telling you, I struggle with that one. The urgency, like, now, I gotta do it now, gotta do it now. That's apparently like a form of white supremacy culture. It doesn't mean that just because you're white, you adopt this, but we tend to fall into these kinds of things. And you don't have to be white to fall into white supremacy culture. It's a way of thinking and being in the world, and it helps you to survive, frankly. Survive in school. You can go to the, there's a website by Tema Okun, that's her work there. We also need to get more courageous. We need to have guts, more heart and more guts. Less up here, more here, more here. And then we gotta have loving kindness, compassion, joy, and equanimity. The last thing is, these are four different kinds of love I talk about. Equanimity is love without discrimination. This is the one I think that we have the hardest time with in the United States. We think if someone is a drug addict, we can't love them. We think if someone's homeless, it must be their fault, we can't love them. And more. This is where we need to do the work, equanimity. I have other talks called From Equity, which is sort of justice, right, to equanimity, which is love. All right, women should be in control, should be taking more power, because women know and just have so much opportunities to express love in all different kinds of ways. And this is how you can stay in touch with me. I'll stop so we can dialogue from there. Thank you. Thank you.
Thank you so much. That was wonderful. So we'll take some questions from in the room and also from our Zoom friends and have some conversation here. If you want to write a question down on a slip of paper, you're welcome to do that, and I can always read the questions. Andrea's got a question.
Yes. So there's kind of the elephant in the room that you talked about, but that didn't talk about in terms of moving forward through this administration. How do you see your work folding into what's happening currently in the United States?
Okay, I'm going to repeat the question just in case those in the back of this room couldn't hear. I'm sure the people on Zoom could hear you through the mic. The elephant in the room, how does your work relate to what's going on, or how can it inform how you will respond to the current administration? You said it more eloquently than I did, but did I get that? Yeah, clearly getting into the halls of Congress isn't going to help us at this time. But that doesn't mean that we should give up on the humanity of the people who are in charge. So I think, first of all, I want to say I don't know. I'm in a place of not knowing. I think a lot of us don't know. I think what's most important is that we do not get activated and immediately start trying to do stuff, because we're going to go in so many different directions. I think number one, we have to stay calm. And that will help our creativity to emerge. We have to be very creative right now. Something I didn't talk about with experiences with trauma is that people who have experienced severe forms of trauma cannot think of the future. They have very little opportunity to have imagination, because they're just thinking about how to survive in this moment, in this time. And what happens is there's a freeze response. People just can't think. So number one, let us take a deep breath. Remember that we are of the earth. Take a long view of time. Stay calm, number one. Number two, whatever emerges that's creative and generative for you, carry on and do it. Stay, do the things that you have the expertise to do. But I think the first thing we've got to do is not let the people who have no empathy hijack our emotional brilliance and kindness. So that's like number one. That's what I'm trying to do right now. Try not to get hijacked. Breathing, breathing, and we'll figure it out. And I think having love with your community, being really connected to the people that you love and the people that you know in your community, create strong social bonds. That is far more powerful, because it helps you know who needs help and when. So especially folks who are immigrants in your community, people that you know are immigrants, reach out, ask what can I do to help, or even if they don't know how you can help them, just express your love. It's amazing that just being loving is a form of resistance. There is zero love at the top right now. No empathy. It makes you kind of wonder, are they actually human? Chilton has just dehumanized the people at the top. They are human. We've got to find a way to get in there and find a way for them to have some social bonds. I can't tell you, I look at Donald Trump and Elon Musk and I think lovelessness is running our country. It's troubling. So I don't really, right now, I'm telling you, I don't know, but I'm just not going to let them get at my ability to love. And they're getting ready to stop universal free lunch, school breakfast and school lunch. They're getting ready to cut the SNAP program. They're getting ready to cut all different kinds of programs, Medicaid, et cetera. There's going to be so many people on the street suffering, needing help. So get creative in your own communities. Get involved in mutual aid. Get involved in creating a solidarity economy. We don't have to rely on capitalism and people making money all the time. Think about creating some kind of food cooperative or a meal cooperative where everybody knows that in their neighborhood there's a meal that can be had once, every day of the week, and share in that way. That's very revolutionary. We've got to get smaller and more loving type relationships. And yes, keep speaking out, keep showing up, and resist. Don't let them roll over you. Have some courage. But know that just loving people is courageous enough. If you need to stay safe and stay out of the way, that's probably a good choice for you. But don't let them get at your heart. That's all. That's probably not the answer you wanted to hear. That's what I got now. Yes, Mark.
So make it practical here. North Dakota is a rather low population density state. So we have many counties with maybe 3,000 or 4,000 people, yet they're 160 square miles. So there may be no grocery store.
Yeah.
You may have to drive distances, but if you can't drive because you've had your license suspended or you're elderly. So what can we do in our state, or how can we make a case? Because one of the problems with hunger in our state is just food deserts and absence of quality food in grocery stores that are accessible. So action point that's relevant to our state.
Yeah, that's tough. That's really tough one. First of all, I want to challenge you on the concept of a food desert. On the East Coast, and I know the context is different on the East Coast, it's far more, populated. Food deserts are insinuate that there's no people around. And it's true, long distances, yes. But there's so much zoning that happens. This food, we call it food apartheid on the East Coast. It's an apartheid system. So you can have places in the city that are food deserts that can't get to the grocery stores, very low quality grocery stores, corner stores, those kinds of things, really expensive. That's not a food desert, that's called food apartheid. It's intentional how food is distributed. That's human intervention, right? So I think those of you who are here in North Dakota can figure that out, but I think that you can get really smart about doing mobile groceries, mobile grocery stores or pop-up grocery stores in places where people are struggling, making sure that if they have SNAP benefits, that they can use the SNAP benefits at those mobile grocery stores, making sure that everybody's got WIC. And sometimes if people may not need food, but they may need money or gas money. So sometimes it's easier just to send a gift card, money that can actually help someone maybe fix their car so they can go get groceries, those kinds of things. But I'm sorry, it's my first time here and I've been here all of like 32 hours and I don't feel like I can venture to say more other than the way food is distributed is humans doing that. It's us doing that. All of our systems are human generated. We don't have to accept this. We can get in there and create a cooperative, like a food cooperative food delivery kind of program. One of the ideas I put in the book is that, the emergency food system itself is a really bogus system. Really bogus. Because what it does is it lists up the people who donate money and celebrates them or donate their time to pack groceries. And then there's photographs where everybody's, yay, me, I'm putting groceries in the bag for the people who are poor. But you never see the people who are poor. And that's because the people who are poor use the food pantries, they're humiliated. It never feels good to go to a food pantry. The food pantries, what they do is separate people from each other. It helps the wealthy stay wealthy and be celebrated. And people who are poor be seen as sort of how problematic, passive, those kinds of things. So the idea that I had in there is that, Feeding America should be a giant food co-op, food delivery co-op, where people are proud to go in there because they're part of the cooperative, they're a member, and make it happen. More solidarity kinds of things. Underground, where you don't necessarily have to rely on the quote state or the government.
We do have a question
Yes.
online there.
Okay, you want me to read it? I will read it. Dr. Chilton, I would like to know from your experience, what is the trend of the kind of support you get, individuals, organizations, government, et cetera, in comparing from the past to current? Would you say the support is improving? How easy or declining? It also looks like the issue of food security is not getting better. From your opinion or experience, what will you say is the predominant root cause, and what can we do to address it at the upstream level instead of the downstream, which is an approach I see being used more often? Yes, emergency food is downstream. So are food stamps. So is SNAP. A lot of people think, oh, that's upstream because it prevents harm. No, actually, it is after the fact. And what that does is that allows Walmart and Target to keep wages low. Then their workers can rely on government supplements such as Medicaid and SNAP benefits. So there's so much profit that's getting generated in the food system, and who's losing is the people who are the low income workers, primarily women of color and low wage work. So yeah, I'm trying to get people to pay more attention to, in terms of downstream. I'll start upstream. Upstream is dealing with violence in our communities, violence in our homes, and trying to redistribute money, get more money into the hands of more people. So that's really important. More love. That's upstream. And that's going to sound silly. I don't want you all to think this is silly. This is not silly stuff. Martin Luther King was talking about love. He's tough. He was tough and said, love is not, it's a frilly or unserious thing. It's actually the most serious thing. It's how we treat each other. That's upstream. Yes, things are getting worse, and they're going to get 10 times worse if we continue to allow the dismantling of the federal assistance programs. If we allow this to happen and we don't push back. And at the same time, it's like, we don't want to just focus on that and say, oh, kind of like Edward Munch, the scream. Yeah, scream a little bit, but hospice it and create something out of the ashes. Do something in your neighborhood where it doesn't take a lot of money. Rely on people to join in on finances, join in with their time, volunteering with their time. I think that's really important. I used to get money from different foundations, Robert Wood Johnson Foundation, Kellogg Foundation. Yes, I took pharmaceutical money. Then about 5 years ago, when we started the Building Wealth and Health Network, I was primarily on government contracts and public money. So tax dollars of people in the state of Pennsylvania were going into our program, which I felt like was a major triumph. I'm not sure if that money is going to be there much longer anymore. So I am a little concerned. The great thing is about the Building Wealth and Health Network, we've worked with over 4,000 people in the city of Philadelphia, and a lot of them know each other and have created their own social networks of support and resilience. I think the resilience is really among the people that we know, and try to find ways that doesn't rely only on the government. Because our political system is imploding, our education system is imploding with their help. Our healthcare system has been imploding for many years. All of the systems that we relied on are falling apart, including the university system. But this is a great opportunity. We've built something out of the ashes. It's time to evolve. Let's do some new things. Yes.
I want to keep talking about love. So, I think obviously it makes a lot of sense that we would focus a lot of love and attention to people who are victims of oppression, who have experienced great harm. And I also see another kind of bifurcation that happens where only those folks are worthy of love. And I'm wondering if you have thoughts around how we also maybe circle back to a really complicated topic of loving people who cause harm.
Mm-hmm.
And if you just have thoughts on that.
I do. It's a beautiful, beautiful question. I do talk about this in the book. It's it's, once you turn the page that says reconsider everything, I think the first, next chapter is about undoing white supremacy, and sexism, and racism, and I talk about how those who cause harm are often people who have been deeply hurt themselves. In the trauma world, you may have heard, hurt people hurt people. It's no secret that Donald Trump did not get a lot of love from his dad. Also, I just learned that Elon Musk was emotionally abused, maybe physically abused by his father. That doesn't mean that someone who was abused and hurt and neglected as a child is going to grow up to hurt other people at all. But the propensity is there because, first of all, you learn it and it gets normalized. Secondly, because you haven't experienced a lot of love, you don't know what love is. And if someone wants to express love, sometimes it's really scary. Sometimes people feel more alive when things are bad and crisis oriented. That's a trauma response. And I also talk about members and witnesses who taught me so much about how they have harmed others. And it felt good. So I actually quote a woman who I can't remember the name that I gave her in the book, so I will not name her. I can't remember her name, her pseudonym. But she said, you know, she got abused by her mother and serially assaulted by her father over the years, and her mother didn't believe her or didn't really seem to care. She said, if I could get my mother by the neck, I would smash her head. Because there's so much stress in the body that it feels good to create that release of the violence. So lots of times violence feels good to people. That's really heartbreaking. So yeah, the people who are causing harm are deeply deserving. Everyone is deserving of love. And we've just got to find creative ways to get in there and help them experience their own sense of humanity and sort of rewild themselves into someone who can be more loving. I don't know how to do that with people I can name at the top, but one thing I talk about in the book is sending metta. It's like breathing in. You can actually try to pull away someone's pain, sort of metaphorically, and pull it into your own body, and then breathe out love, peace, understanding. May your life be filled with ease and wonderment. And so I do that actually every day when I read the headlines, like, oh my God, I can't believe this one. And yes, I do bang my fist on the desk, but then I try to counteract it with sending love out into the world. Then there's another thing about, and just as a white woman, I want to talk about how white people over time, my family's been here for 400 years. So yes, my ancestors were enslavers and were carried out the genocide. And that's in my DNA, and that's like, oh, I can't cut myself off from that. I've got to go back and learn about that history and learn how to unfreeze myself. I think white folk, my mother did not want anybody to express any emotion. You know, stiff upper lip, and northeast, kind of like Boston Brahmin. Chin like this, up like that. Firm handshake. I actually talk about this in the book. And a lot of that is sort of defensive mechanism, because people who cause harm dehumanize themselves in causing that harm, and it creates a trauma for them. And a part of that trauma response is to cut off your emotions. That took me a long time to get to that. It's like people learn to cut their emotions down. And I talk more about it in the book. I wish you the best of luck with that one. But that's why I'm saying love and talking about your emotions is really important. It's revolutionary. Freeze the ice.
You've given us so much to think about and
So good.
activated, I think. Turn the heat up under some.
Okay.
But in the purpose of love and trying to create a better collective through our efforts, but have it be founded on love.